CEO of AMCHART Blockchain and Cryptocurrency. We're a member of the AMCHART group, which has been around for 15 plus years and been involved in many technology projects. Let me tell you a little bit about us. AMCHART group was started in 2003 with $125 in our pocket. And since then, we've grown to be a $50 million debt-free company. Now about myself, I originally started in tech back in the 90s with a small little mom and pop shop. And then eventually when the dot-com bust happened, I sold my company and moved into healthcare. I followed in my father's footsteps and decided to become a physical therapist and did my master's degree and eventually did my doctorate of physical therapy. But always felt the tug and pull to be back in tech. So in 2010, Ken Poddick and I decided to start a healthcare division of AMCHART Group that helped small to medium-sized medical practices, clinicians, hospitals, to be more efficient in implementing HRs. But we always kept on hearing the same issues. And some of you may have heard these things. Why do I fill out the same paperwork over and over when I go to a doctor's office? Why is it that when I go to one doctor and he refers me to another, I can't access that information or be able to tell them what medications I'm on or what I'm doing or what labs or diagnostic tests that I perform? And then I also heard from patients and families. How many of you had loved ones that you take into a doctor's office and you didn't know what medications they were on or what they were involved with, and you couldn't portray that information to a clinician? When a clinician doesn't have information, it's difficult for them to be able to make the right medical decisions. And so when we combined together, when blockchain technology started coming out, we decided to create AMCHART, which is our universal medical record. At its core, AMCHART has three really cool features. One is the medical record itself. And if we did nothing else but try to get you the medical record, that'd be enough. But we decided to do a couple other things. The medical record is going to be scalable, reliable, and easily transportable. Each one of you probably has a cell phone right now and can access your bank account as soon as you need it. Most of you probably have access to a Jack's wallet or some other wallet on your cell phone that you can move money. How many of you can log in and get your medical record right now? Probably not very many of you. And the reason is large companies hold this data and they keep it to themselves because they use it for their own purposes. There are two large companies in the United States and they own 50% of the medical records. Yet they don't allow for interoperability or exchanges, or the ability to connect with them to actually share that information. So that's what we want to change. So first we have AMCHART itself, which is going to be the electronic health record, and in phase 2 we actually have a mobile application that'll take real-time data from IoT wearables and devices and port it in not only to your mobile app, but also into the electronic health record itself. So when the doctor pulls up a patient dashboard, he sees your vital signs right away, so he makes the best medical decisions possible. And the third is that we want to take that data and take it one step further. We're adding machine learning and AI processes to that data. So we're also going to incorporate things like medical, family, social history, lab work, diagnostic, and blood work. Because we want to attack the three biggest things, or population health issues that are out there: obesity, diabetes, and hypertension. So through our system of incentivizing you, we want to work on programs that help bring those costs down for payers and providers, but also makes your health better. So currently, in our phases, phase 1, we've developed the MVP. So it's running on the blockchain itself, and we also have basic patient profiles on there too. So you can log on, on the test network, and we can put in your information, your allergies, your medications, and it runs end to end. The second thing we've done is on phase 2, we're ahead of schedule. So our mobile application is already running. You can come by booth 42, we can show it to you. But we've already integrated IoT devices and the wearables, so that data is already porting in. So the Fitbit I currently wear is going to my mobile app on my phone right now. And our AI platform is being developed by our team of data scientists we put together that work in the Texas Medical Center. And that's one of the largest medical centers in the United States. And so they're working on their data modeling and coming up with the right answers that we want to see from that data. So, let's go back for a second. There it is. So this is where this is kind of our matrix. And how it works is this, is the data belongs to you. So you should be incentivized for your own data. So it's pretty straightforward. You build a medical record on our platform, you earn tokens. If you maintain your medical record for a period of time, you earn tokens. If you decide to work on a medical wellness program with your doctor, and we put it in our system, and you follow that plan, you earn tokens. If you decide to share your data to research organizations, pharmaceutical companies, again, you earn tokens. But then you say, what do I do with these tokens? There's a standard issue of, messing with them, but a lot of people have difficulty with exchanges, and especially patients that are elderly may not want to be able to do that. So we're partnering with blockchain loyalty programs that allow you to port those token values into their program and exchange them out for gift cards, or airline miles or travel, so that you can be rewarded for the things you're doing for your own health. And how providers benefit is pretty simple. As we are moving to value-based payments, what insurance companies are finding is if we keep you out of the hospital, if we allow you to have further interventions in the clinic, but not in urgent care or ERs, your reimbursement goes up. And when we're using our platform, especially your mobile app, so let's take an example. So let's say your blood pressure is high, and you're using our wearable device or integrated device. Well, that actually can port into the record itself and alert the doctor who can do a telemedicine visit on our app before you go into the ER. So for us, there's a lot of our tech that I don't really have a lot of time to talk about it, so you come to our booth and we'll share a little bit more about our tech itself, and our CTO is there too, so we can talk a little bit more about our processes, our AI platform, how we do our, who are involved in the consortium, our members as far as our whole platform, so we can discuss all those things with you. But I wanted to go on and talk to you a little bit about our team itself, which consists of myself, who's been around for EHR development and for consulting in the medical realm for like 15 years. Choga Palimatai has been around for many years and has developed several different programs on EMR platforms and blockchain development, and Ken Parekh, our CEO. We have a list of advisors on our website. You're more than welcome to take a look at them, but some high-end advisors all throughout the United States that are helping us out. But I wanted to also show you this. What we're doing is we're currently in a pre-sale right now, $45 million at a 25% discount. And we went to all the people that we've done business with in the past and asked them to be involved. And so far, just word of mouth, we've raised half of our funds. And currently, what we're doing is we're offering you this now for accredited investors for the rest of the remaining amount, and then we'll do our public sale in the month of March. Our goal is this: no founder, no executive, no anybody gets a token. All of that we want to go back into development. We've been able to develop a lot of innovative technologies from our current platforms, so we want to give back, because our goal in the end is that we want to change healthcare by using your data. You can already have your data, but what we'd rather do is use your data to proactively manage your health and make a difference in your life and in your family's lives. Thank you.
All right. Awesome, bro. Thank you very much. Next up,